Hi, I'm Dr. Lee Schwamm. I'm the head of the Center for TeleHealth at Mass General and the vice president of virtual care at Mass General Brigham. And I'm really excited to be here today with Dr. Mihir Kamdar, who's the section head of palliative care, to talk to you a little bit about something we call CareTeam Connect, which is the latest iteration of an iPad at the bedside that we're using to augment patient care. Many of you may remember it as VIX when we rolled it out during the first pandemic, but it's a completely redesigned tool, very powerful, now enhances the care of patients both for nursing and other care team members at the bedside, but also for physicians. And I want to help you understand a little bit more about how this innovative product is being used and how virtual care is much bigger than virtual visits. And this program, for example, is independent of Epic and is really a product designed to enhance the bedside evaluation and follow-up of patients. So let me turn it over to Mihir and tell us a little bit about how you've been using the program.
Thanks, Lee. It's great to be here with you today. And, I have to be honest, I found CareTeam Connect to be a great way to make inpatient care for my patients both more effective and efficient. And if it's okay, I thought maybe I'd share a few case examples that I've used this platform, hopefully to the benefit of my patients.
Yeah, please do.
So one example is if I have a patient, let's say a cancer patient that's been admitted with pain, what I like about CareTeam Connect is it allows me to be able to check in with the patient later in the day. So for example, I've done my in-person visit in the morning, we've made adjustments with the patient's pain medications, we've started, say, Mr. Ramirez on a PCA. From my office later in the afternoon, I can beam in and just make sure that he's doing okay, that his pain is controlled, that he's not having side effects. And it allows me to feel that my care is not only more effective, as I mentioned, but also more safe. And so I found that later in the day follow-up, whenever we're making an intervention, to be really helpful. Another area that I found to be helpful is for a virtual follow-up visit. So for example, I do think that as a consultant, doing an initial consultation in person is really important to develop rapport and get a sense of the patient. But there are times when a patient is stable, and on subsequent visits, this platform allows me to dock in with them virtually to make sure they're doing okay. And that allows me to be more efficient and actually broaden the reach of my care, and that I might be able to actually see more follow-ups in a given day because of how nimble this platform allows me to be able to make sure I'm getting the care need accomplished, but to be able to do it virtually. Another example that we often utilize in palliative care is around family meetings, right? And this has been really important, particularly in COVID, where family members may not be able to come in. And even aside in normal circumstances outside of COVID, where a lot of our family members are working, it's hard for them to come into the hospital for midday family meetings. And what's nice about this platform is that family members can use this platform to zoom into the visits. And in addition to family members, we can also pull in, patients' longitudinal providers from the outpatient setting. So, for example, their primary care physician, who they've really, developed an important and trusting relationship with, or their heart failure doctor, or their general surgeon. This allows all those key players to be there for us to be able to have really important and nuanced conversations. And lastly, another key element that I find beneficial with CareTeam Connect is the ability to bring in interpreters virtually.
Yeah.
And, I think that's so important, particularly in palliative care, where we're having, really nuanced conversations about difficult topics. Having the patient be able to see the interpreter just adds a whole nother, level of benefit on top of, having to just use a phone where all they're hearing is a voice. I think it helps with trust. It makes the conversation feel much more impactful and connected. And what I found is that anytime there's a new technology, there's always kind of the energy it takes to adopt. And, as a clinician, everyone is so busy. How do we intersperse this into our workflow? And what's nice is that this platform is really easy to use because it's web-based. You can use your computer, your phone, your tablet. Even if you're just trying to do a continuity visit, you can do it from your home to check in on that patient that you've known for so long. And I will say, patients really appreciate the follow-up. Even though it's virtual, they do feel a sense of connection even through this virtual medium. So I found it to be really helpful in my care, Lee.
Well, Mihir, what a great array of different examples that you've provided. And I'm sure our listeners are thinking about how they could apply that to their practice. One of my, I heard as you were talking, thought back to the IOM criteria, the STEEP criteria around what quality in care means, the domains of safe, timely, efficient, effective, equitable, patient-centered, and you really hit on all of those. It's really remarkable that we're able to provide this kind of care, not as a substitute, as you pointed out, for in-person care, but as a way to augment that care experience. And I think what I want to remind people is that we're looking for additional use cases. What's the next innovative idea that somebody's going to come up with where we could say, hey, that's a great use for CareTeam Connect. And you mentioned bringing in the primary care doctor to a team meeting. Well, the primary care doctor doesn't even need a team meeting now. Now they can log in directly from their office and just give a quick check-in. You know, how are you doing? I heard you got admitted with pneumonia. I'll check in with your doctor. I think that kind of continuity is what we all have strived to deliver, but it's just been really hard to do logistically. And this platform hopefully makes it even easier for us to bridge that gap. So, Mihir, I'm really grateful for you spending a few minutes with us. And if people have more questions about the platform, there's information available on the Apollo website and also on the Virtual Care Resource Center. All you just do is type in virtualcareresourcecenter.partners.org, and it'll take you there. And wishing all of you a safe transition through the spring, and hopefully CareTeam Connect will help you get your job done.